Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
All right, Austin, I just showed up to have my blood drawn, and it really makes me anxious when I have blood drawn. Is there anything you can tell patients that makes it more relaxing for them?
Absolutely. Just take deep breaths and try to calm yourself, and it's always important to try to talk to the patient, get their mind at ease, get the subject off of the needle itself.
Is it important to be fasting?
Yes, it is, absolutely. We want you to be at a lower lipid and cholesterol. You want that to be a true number to be resulted.
Now, you mentioned chemistry, so we're going to go to chemistry and talk about that lab test. All right, Laura, I just had my blood drawn. It comes to you. You have to spin it down to get a certain part of it and do some testing on this machine.
Correct.
Why do you spin it down?
It's going to separate our components. We're just going to use the serum off the blood. The whole cells will go in the bottom. That's just the method that this actual analyzer uses.
And what do you test on this machine?
Several things. We'll do your cholesterol, your comprehensive metabolic panel, your basic metabolic panel. Those involve many components within them. We do liver testing. We'll do your iron, your TIBC here, magnesium. We've expanded our test menu quite a bit within the past years.
So all those things, like you mentioned, liver function for hepatitis, your sugar to see if you've got diabetes, cholesterol to make sure your heart disease risk is low. You also do vitamin D and thyroid.
Yes, and that's done on the analyzer right over there.
So if you got low vitamin D, you want to prevent osteoporosis, and if you're tired, you might want to get your thyroid fixed.
Exactly, yeah.
So you can do a lot of tests on this machine right here.
Yeah.
All right. Well, next we're going to go to see about COVID, flu, and strep testing. All right, now we're in the section where we have some infectious disease, and we notice since we're in the office, we all have our mask on because COVID. And this is where you do the COVID test, but you also do other tests, correct?
COVID, yes, flu, strep, and RSV.
RSV, which is the virus that causes the little kids to wheeze a lot.
Wheeze a lot, you're right.
So explain how that occurs.
Okay, so we receive a specimen from a swab like this, which is a nasal swab and or throat swab. And we have different test kits, and they're specific to whatever test we're going to be doing.
So if you're doing a strep test, it goes in one kit, flu test goes in another kit.
And there's a whole memory here. It tells you which one you want to do.
And that basically comes up, says, hey, you have the flu, what type of flu you have?
A or B.
A or B. Strep is positive for strep throat, yes or no?
Yep.
And COVID.
COVID and RSV.
That's a minus.
Yep.
Okay. All right. So this takes about how long to do?
Takes about 15 total minutes.
Okay. From the time you get the swab, but you got to get the swab out of the nose or throat first.
Right.
Okay.
And we get the answer.
All right. Now this is the infectious disease, but you also do urine tests looking for urine infection a lot of times over here.
A lot of times, yeah.
All right. So tell me what happens once you get a urine specimen. Do you have to do anything to it or before it goes to the microscope?
Okay. So we will take the urine specimen and we will do a dipstick, and it does 10 different tests on our machine, and then we will spin the urine down and look at the sediment in the microscope.
And the one that you do on the machine, what are some of the things that you look for in the urine?
We look for glucose, we look for blood, we look for white cells, and like liver function, kidney function.
Okay. So once you spin it down, you put a little bit on the microscope, and that's where you look at it to look for infection cells or crystals or whatever you might see.
Crystals, whatever, bacteria, white cells, red cells, epis.
Well, we finished the infectious disease area, and now we're going to head over to the blood count machine. All right, this is where I said you do blood counts. Tell me what a blood count is and what you're looking for on this machine.
Okay, we do a complete blood count. That's what a CBC stands for. It does white count, red count. It does what we call an H&H, is your hemoglobin hematocrit. It tells you if you're anemic, and a platelet count. Does a differential too on your white cells.
All right, so you mentioned white cells. That's what we use for looking for infection. So if you've got an elevated white count, could be infection, could be leukemia. So you can do that. You can look at the white count. You can look for anemia. And platelets are what cause your blood to clot. And if they're low, you might be worried about bleeding disorders.
Correct.
And it does all that there.
Right there.
All right. Well, Sherry, you're the lab manager and you're responsible for how all this works. The lab staff work hard. You're also CLIA certified and Prevention Test certified. Tell us a little bit about that.
So we have a certification body that comes in and checks the quality of our laboratory every 2 years for CLIA. And in doing so, if we pass inspection, then we get a certification like this every year. It's a requirement of CLIA that we be certified.
Good. And the lab staff, they really take their job seriously, do a great job.
They bring 100% of themselves every day. They are patient focused and we have a good time at the same time. We can balance it well. I can't speak highly enough about our staff.
Okay. Well, thank you for all the work you do, and we appreciate it. That's our lab at Family Practice Associates.
Thank you.